The days of old are long gone when we require only one pathologist description of what may be seen in tissue sampling from a biopsy of whatever source. So, in this example, this is a postmenopausal bleeding female, and the question becomes, why is she bleeding? Now, when you just look at the fragments of tissue, one can easily say, well, this is just normal postmenopausal tissue. But nothing is so descriptive. So as this sample was designated as endometrial tissue, you can see that most of what we're seeing is, in fact, lower uterine segment endometrial tissue. And you can see squamous metaplasia right there at the center of the sample, and that's a part of the lower uterine segment endometrium or cervix, upper portion of endocervix, with some squamous metaplasia. And then the stroma tissue looks pretty inactive in some parts, but in other parts, as I go down here, the stroma seem to be a little more cellular than I would like to appreciate. But all in all, this is a crush sample. So some of that could be crush artifact, making it appear to be cellular. I don't see any level of nuclear pleomorphism or mitotic activity. But if you go over to some other areas like this, you can see some what appears to be inactive endometrial type glands separated from the stroma and in a background of fibrin blood clot. So all of that keeps it in perspective that this might just be some perhaps postmenopausal bleeding from some sort of hormonal change, but not necessarily pathologic. But in other areas, I want to show you where the glands look to be a little more proliferative. And of course, you can't make a lot of it when you don't have intact. So there is no intact endometrial tissue where you see endometrial glands and stroma. So a lot of this is lower uterine segment endometrium. But again, you have to pay attention to the glands. Like this particular area right here, I don't like to see papillary fronds like you see here. So there's slight proliferation, but that's tubal metaplasia. So I'm not really worried about those particular glands because I think you can see a little cilia if I go up and down on some of these glands. So that's just classic tubal metaplasia. I don't see any real significant atypia, but that's definitely endometrial based glands. But I don't see any level of atypia. So no rounded nuclei, no prominent nucleoli and so forth and so on. But so we're okay with that, but I just don't like to see that level of proliferation in a postmenopausal person. This right here is looking like this might just be shedding endometrium. You see whether the stroma is collapsed and there's a glands around it. So all in all, we're still within the benign spectrum of endometrial tissue. So, and you can see the fibrin blood clot there. So here again, you see the papillary tufting. I just don't like to see this in postmenopausal women, but this again is just simple tubal metaplasia and still within the benign spectrum. It's just that the glands are a little more proliferative than what I would like to see. I just hate to see these proliferative glands, particularly in a person with postmenopausal bleeding. But you can see there is very discrete evidence of tubal metaplasia. You see the cilia. Look at the glands at the 12 o'clock. You can see the cilia as I focus up and down. You see the little hair-like structures on the surface of. So those glands are benign, no doubt. But I just don't like to see them forming a little papillary group, almost like a papillary structure. But that, be it as it is, I think this is still within the spectrum of benign. So just a little proliferation here. So that may be hormonal related. Here's a fragment of squamous epithelium. Notice how mature that squamous epithelial fragment. Now that's coming from the cervix. So there's definitely cervical tissue here. And those mature squamous epithelium, look at you see quite a bit of superficial squamous epithelial cells. And that in itself suggests that there's a slight estrogen overload, just slightly, not much. And that could explain a lot with the proliferative endometrium. Perhaps there's some exogenous estrogen. I don't know if it's being made by the body or if it's dietary, but we need to we need to be concerned about where that extra estrogen may be coming from. Now this is slide B as we go on low power, and it was designated as endocervical curettings. And you can see most of this is just detached benign endocervical glands with mucus, squamous, and acellular debris. But this is completely benign here. And then you can see more, if I can go zoom in on that, of benign endocervical glands actually detached from the stroma as I bring it into focus here. But that's just all benign endocervical glands. And some of those glands perhaps even may be a little tubal metaplasia going on with those. But again, they're detached from surrounding stroma. But that's a bit more glands than I would like to see. And that's definitely coming from the endometrial, although you don't see any endometrial stroma. Now, some of those glands are indeed endocervical, but some look like they're probably tubal metaplasia. But you can get tubal metaplasia with the endocervix as well. So we're still within that spectrum of benignancy, that is without malignancy yet. And there's a little squamous metaplasia with some endocervical glands. And so, okay, as we continue to go around, there's squamous metaplasia there. And as I scan around, just most of this is just scanty tissue fragments, nothing to be really concerned about. So so this is all good right here. And you want, in endocervical curettage, you want to see just scanty detached fragments of glands. So you don't want to see intact tissue fragments. That would be something to be concerned about. But there's a little a nest of squamous metaplasia there. As I bring it to the center, that's just benign squamous metaplasia. And that's all mucus, inflammatory and mucus debris. Okay, so we're going to go to the final slide. So this is post-ablation tissue. Most of this is fibrin clot and crushed stromal elements. So we're going to go and look closer at those elements. It's not that much tissue in this area. Most of this is, again, ablation from cautery, artifact distorting the stroma. This is endometrial tissue here, but it's also got some myometrial wall tissue. So the thing that you worry about is that could there be a little component of a submucosal leiomyoma? And so, I mean, you're getting a little more endometrial glands and stroma. But again, look at the, notice the stroma. And I'm going to go down on this one just to kind of highlight some of the features here. So when you look at this stroma, that stroma is a little more cellular than I like to see again. And it has that whorled pattern. So maybe a little submucosal leiomyoma, perhaps. Maybe even adenomyosis, where you see the endometrial glands within the stroma there. And as I focus up and down, just to keep in focus, you can see, again, the crushed artifact somewhat distorted. There are some blood vessels there, so you can entertain the possibility, is there some sort of endometrial polyp? But I just don't like to see this degree of cellular proliferation in the stroma. So I'm still concerned that perhaps there may be even a submucosal leiomyoma responding to what I'm presuming to be increased amount of estrogen response. Okay, but again, there's nothing obviously that looks like cancer here, and even if we were to go to a closer view, you can see that those cells do not, although they're pretty cellular, they're not showing any degree of cellular pleomorphism or even mitotic activity. Now, some of these are probably hyalinized blood vessels from scar and okay, but I just don't like to see that much, that degree of cellular proliferation in the muscle cells. But nothing cancerous that you can just straight out call cancer. Thank you for listening to the video.